Welcome back. Dr. Jason Day and Dr. Makenzie Schouten are back with us to discuss proper chiropractic care for children and pregnant women. And we're going to get into that in just a second. But I do got to ask, because what I've picked up from the first segment is it isn't one size fits all.
No.
You treat an individual. So you want to expound on that a little bit, and then I'd like to go to you to talk about what you do with little kids.
Yeah. Well, the nervous system is incredibly complex, and if there's one huge limitation in all of healthcare is that we treat everyone the same. It's actually on the cover of Newsweek, or not too long ago, they were talking about how prescription medications work differently in women than men, as if that was some profound statement. I'm like, of course it does. And we do a lot in the sensory community, we'll dive into that, but you could take two boys, age 9, with the same diagnosis of ADHD. It's a radically different day for those kids, radically different challenges. Yes, they have the same diagnosis, but the idea that we can approach healthcare, approach neurology, and approach all these kids with the same cookie-cutter plans and cookie-cutter medications, or even cookie-cutter chiropractic, is problematic. That's why we do those scans and specific neurological tests to find out what does your child need? How is your pregnancy going? We want to answer those questions from day one so that we can give you a blueprint. I can promise you everybody's different, though.
Oh, I've no doubt about it. Doctor, now you're seeing children and babies. Mm-hmm. So when a parent brings their child to you for maybe the first time, what are some of the things you're seeing, and how do you address it and correct it?
Yeah, so we get the question all the time about who we serve, and we serve anyone that has a brain and nervous system because everyone has stress. And our world, especially in the last year, has been incredibly stressful. Yes. And so we see that, yes, in adults, but also in kids. And so we have people come to us with kids that have colic, constipations, anxiety, ADHD, all spectrum of things. And our job is to calm that stress response and help them function at their best.
How young can the patient be?
Absolutely, that's a great question. We, this past week, saw someone that had brought in their 4-day-old baby. 4 days? Yeah, and asked Dr. Jason about.
So I have a slightly different perspective, because I was there when my boys were born, so we're talking still placenta attached. And we can understand, and we get this question all the time, and I respect this conversation or question even before it's asked. It's like, all right, I know my child has a challenge. These scans are amazing and we can see it, but what are you going to do to my baby?
Yes.
Like, is it safe? Are they going to feel it? And most kids end up running and jumping on our table, not a newborn. But the pressure for a baby, an adjustment, is a pressure you could push on your eye with and be comfortable again. Again, we're not racking and cracking bones like you see on YouTube. I apologize for those videos. That's not us. It's a very gentle, specific pressure to stimulate that spinal cord in a very specific way to release that neurological function so that it can adapt and heal. But it's perfectly safe. It's perfectly gentle and perfectly specific to that person. Like if I'm taking care of a 300-pound lineman, they're going to get a slightly different adjustment than a baby, yeah, for sure.
What kind of results are you getting? I mean, I'm sure it's positive and good results, especially with the kids. Let's say they are suffering. You mentioned ADHD?
Yeah.
You can actually treat that?
This is like an hour-long workship, but I'll boil it down in about 30 seconds. We talked about that fight or flight spectrum, the sensory spectrum, the sympathetic spectrum. It has different names, but this is the spectrum of spectrum challenges. When a child's neurology and brain is overwhelmed due to birth trauma, irritations at the brainstem, environmental toxins, slips and falls, there's a lot of things that can stress a child's nervous system. Not only are they in fight or flight, they're stuck in fight or flight. That is that spectrum of spectrum challenges. And not to oversimplify a very complicated issue, but a lot of the symptoms, when we check the boxes of how do you diagnose a child with ADHD, it's all symptoms, but it's all symptoms of fight or flight. And it's hard for the brain to develop or even adapt during fight or flight. We've all had our stressful days before. Sure. You can imagine your most stressful day, noisy, traffic, IRS audit, wife's mad at you, you had to skip, like everything's going wrong. At some point you just want to turn down the volume and just shut the door of the closet and just sit down and remove yourself from those senses. When we're running from a bear, our senses are heightened. And that's good in nature because I need to see better, hear better, balance better. But if you crank that volume up exponentially loud over a lifetime, over a year, 2, 3, or 4, the brain cannot process that energy input, that sensory input. That's why they call it a sensory processing disorder. That's a very simple explanation of a very complicated issue. But again, those are all the things that we want to measure. The purpose of the adjustment is to get out of fight or flight. That's really good for your lower back. It's really good for your brain and sitting still in class or sitting still emotionally, a gut issue. I mean, it's so tied together because all these different symptoms and diagnoses are rooted in the same nervous system. And if we can tap into that, we're not just putting a puzzle together, we're laying a foundation for the puzzle. So is our physical health important? Of course. What we eat, important. Emotional, spiritual health, all important pieces to the puzzle, but we have to have a table, a foundation to put that puzzle together. That's a brain and nervous system that's even receptive to the idea of health. And that's what we do.
Pregnant women. Now, are you treating the woman or the
Yes.
baby? What are you doing?
I'll let her dive into that one. She
Yeah.
loves taking care of our mamas here.
Yes, absolutely. So we are helping those moms that are experiencing all of those stressors. So we talk about the 3 different types of stress that we often experience as human beings, and those are physical, chemical, and emotional stress. And during pregnancy, it's that perfect storm of all 3 of those. Of physically, their body is changing so much. There's a lot going on there. Emotionally, they're adding a new life to their family. There's so much, and we all know that being a mom isn't the easiest job in the world as they're preparing for that. And then chemically, their hormones are surging. So with pregnant women, we're especially needing to calm that nervous system and help them to adapt so that they can adapt to all of those changes that they're experiencing.
So again, you're treating the individual. In a case like that, I'm just trying to understand and hopefully help the viewers understand. What kinds of things would you do to a pregnant woman to help, take care of the issues you just kind of ran down there? I mean, what is it that you do?
Yeah, so again, it's those same very gentle, very specific adjustments. So we also utilize a specific technique called the Webster technique that is individualized for pregnant women, along with incorporating other techniques. So we have pregnancy pillows, and our tables are specifically designed to see pregnant women where they drop where the belly is, so everything is comfortable and safe for them.
Yeah, we've had moms up to 41 weeks, laying on their belly, and they don't want to get off the table because it's the only time. And again, it's perfectly safe. You'd have to see these tables. They drop out in specific ways that support. So not only is the adjustment incredibly safe, it's incredibly comfortable to where they're like, can I just take a nap here? But if you think about it, pregnancy is a marathon. And instead of trying to treat the marathon as a pathology, it's like, how do we train ourselves for this? And ultimately, the purpose of an adjustment, whether it's for a newborn, a child with sensory issues, or a mom having a baby, is to increase the body, the brain's ability to adapt to the challenges of life. Pregnancy is a challenge of life.
Yes.
Going to work, that's a challenge of life. Watching the news for 8 seconds, it's a challenge. We have so many different things coming in. And again, we can try and tiptoe or live our life in a bubble, but it hasn't really helped. We lived in a bubble for the last year, and all the health statistics are tanking.
Yeah.
And again, we're not saying the bubble's bad or unnecessary, but we have to strengthen ourselves from the inside. So much of healthcare is so focused on the symptoms on the outside that we forget to look at that person. And we get so focused on a symptom, the fire alarm, that we forget to put out the fire.
Fascinating stuff, really is. I'm learning so much. Don't go away, because up next, we're back with the doctors to discuss sensory challenges and anxiety.